The VenaSeal therapy is actually the newest therapy out there for varicose vein disease. And what that technology involves is essentially a super glue for varicose veins, or a way to close off abnormal veins in the leg using a medically formulated glue that is extremely safe, extremely effective. The medical glue has actually been used for other applications over a period of many, many decades, but for the use for varicose veins has been a recent advance as a result of further medical studies proving it not only its effectiveness but also its safety for treating varicose vein disease. Some of the advantages of VenaSeal over some of the other minimally invasive varicose vein treatments are that only a single Novocaine injection is required in order to access the vein, whereas a lot of the other varicose vein treatments require several different injections to numb the entire vein that you're treating. Rather, with the VenaSeal treatment, all you have to do is numb one small area of the skin just to get an IV in, and then the rest of the treatment doesn't require any sort of anesthesia or injections or any shots that would hurt, because as you inject the medical glue into the vein, it's not associated with any discomfort, and so it's not required that the patient receive any sort of anesthetic. So patients that may be really scared or phobic of needle punctures or shots, it's a great procedure for them because they don't really have to go through any discomfort at all to get the treatment done, and they can get over that anxiety of worrying about multiple injections in the leg to treat it. Some of the other big benefits is that there's no requirement for uncomfortable compression stockings to be worn after treatment. Almost every other vein treatment out there requires compression stocking use, maybe for a week or two after the treatment. And that's okay for a lot of patients, but patients that are extremely active or into exercise, or they have events coming up and they don't really want to have to wear a medical grade stocking on their leg for a week or two, they can go straight out of the office with no stockings, really no discomfort, and be back to themselves very quickly without the inconvenience factor. Another huge advantage of VenaSeal over other varicose vein treatments is the fact that you can resume immediate full activity, including regular exercise, including jogging, biking, immediately the day following the treatment. That's not true of many varicose vein therapies, which require up to 2 weeks of no vigorous exercise in order to make sure that the treatment is effective. The reason that VenaSeal doesn't require that 2-week waiting period or the compression stockings is really because it has an immediate effect. Just by injecting the glue, the vein is immediately closed. You don't have to worry about the vein opening, and you don't have to give it time for the treatment to work. Rather, it's an immediate effect over literally a matter of minutes after the injection is done, the vein is gone. Although VenaSeal is a great therapy and a newer therapy that many vein specialists and patients are excited about, the big downside of the therapy right now is that insurance companies aren't willing to cover the cost of the therapy. All the other major varicose vein treatments typically are covered under insurance criteria, and the reason the VenaSeal hasn't been accepted by insurance as a covered benefit under plans is really because it's such a new treatment that they haven't had time to really look at the treatment as a therapy that they're comfortable with. The medical community has. They've looked at the safety, the effectiveness, and we feel like it's an excellent treatment that has an extremely high success rate of over 97% success. We are confident as vein specialists that the VenaSeal therapy will eventually be covered by health insurance. It's equivalent to the other therapies in terms of the satisfaction rate of patients, the effectiveness of treating the vein problem, the cure rate, etc.